Understanding the psychosocial impact of facial differences in pediatric populations, a nursing perspective. This presentation explores the psychosocial challenges faced by children and adolescents with facial differences. We will examine the emotional, social, and developmental impacts and discuss nursing strategies to provide holistic, supportive care. We will begin by reviewing the psychological and emotional effects of facial differences, followed by the social and developmental challenges these children face. Next, we will cover communication techniques to foster emotional safety and reduce stigma. Lastly, we will discuss collaborative approaches for holistic support involving families and interdisciplinary teams. Psychological and emotional effects of facial differences in children and adolescents. Children with facial differences often experience unique emotional responses and challenges related to self-esteem and identity. Understanding these effects is crucial for nursing professionals to provide empathetic and effective care. What are facial differences? Craniofacial anomalies, congenital malformations such as cleft lip or palate, hemifacial microsomia, craniosynostosis. Dermatological conditions like visible skin disorders that affect the face. Examples are severe acne, rosacea, vitiligo, eczema, and psoriasis. There's also trauma-related changes. These are injuries that alter facial contour or symmetry, such as fractures, burns, scarring, reconstructive surgery outcomes. These conditions share a common thread. They alter the typical appearance of the face, which is a primary cue for social interaction. Visibility amplifies risk because the face is the most observed body part during everyday encounters. Psychosocial sequelae include anxiety, depression, reduced self-esteem, social isolation, and impaired quality of life. For congenital craniofacial anomalies, the prevalence is about 1 to 2 per 1,000 live births. Why visibility matters? Because early exposure to peer scrutiny cause long-term self-image concerns. For those with moderate to severe facial acne, which is about 15% of adolescents, visibility matters. Visible lesions, they trigger stigma, bullying, and social withdrawal. And for facial burns and scars, it's about 0.5% of hospitalized trauma patients. The prominent scars become focal points for unwanted attention. Understanding emotional responses and self-esteem. Facial differences can impact a child's emotional well-being, influencing feelings of self-worth, anxiety, and depression. Nurses must recognize these emotional responses to support positive self-esteem and resilience. The impact of facial differences on social relationships. Facial differences may affect peer interactions and friendships, sometimes leading to social isolation or bullying. Nurses play a vital role in helping children navigate social challenges and fostering inclusion. Social and developmental challenges associated with facial differences. Facial differences can influence a child's developmental progress and social experiences. Awareness of these challenges helps nurses tailor interventions to support healthy growth and social integration. Developmental milestones and peer interactions. Delays or differences in achieving developmental milestones may occur due to social barriers. Positive peer interactions are essential for development, and nurses can facilitate this through supportive environments. School experiences and educational barriers. Children with facial differences may face challenges in school settings, including bullying, stigma, or lack of accommodations. Nursing advocacy can help address these barriers and promote equitable educational access. Effective communication is key to creating a safe space for pediatric patients with facial differences. Nurses should use strategies that foster trust and reduce stigma in clinical interactions. Establishing trust and rapport in clinical settings. Building strong nurse-patient relationships involves active listening, empathy, and consistent support. Trust encourages patients to express concerns and participate in their care plans. Language use and nonverbal communication. Choosing respectful language and being mindful of nonverbal cues can help reduce stigma and promote emotional safety. Nurses should be aware of how words and body language impact patient comfort. Nursing role, psychosocial support and advocacy. Start with assessment. Screen for emotional distress, body image concerns, and social functioning during routine visits. Use validated tools like the Body Image Scale, PHQ-9, which are tailored to facial difference populations. Education and counseling. Provide accurate information about the condition, treatment options, and realistic expectations. Teach coping strategies, mindfulness, positive self-talk, and stress reduction techniques. Referral and coordination. Connect patients with multidisciplinary teams such as dermatology, maxillofacial surgery, psychology, speech-language pathology, and support groups. Facilitate access to community resources like peer support networks and advocacy organizations. Advocacy. Promote inclusive policies in schools, workplaces, and healthcare settings, such as anti-bullying programs or reasonable accommodations. Empower patients to voice their needs and preferences in care planning. Continuity of care. Follow up regularly to monitor psychosocial progress and adjust interventions as the patient's appearance or circumstances change, such as post-surgical recovery or and puberty. Collaborative holistic support for children with facial differences. Holistic care involves collaboration with families and healthcare teams to address the comprehensive needs of children with facial differences, ensuring patient-centered and effective care delivery. Partnering with families for patient-centered care. Families are essential partners in care, providing insight and support. Nurses should engage families in care planning, education, and emotional support to improve patient outcomes. Interdisciplinary teamwork in pediatric care. Effective care requires coordination among healthcare providers, including nurses, physicians, therapists, and social workers. Interdisciplinary teamwork ensures comprehensive support addressing medical and psychosocial needs. Understanding and addressing the psychosocial impact of facial differences in pediatric populations is vital for nursing practice. Through empathy, effective communication, and collaborative care, nurses can significantly improve the well-being and quality of life for these children. Facial differences are common and highly visible, creating unique psychosocial challenges. Nurses are pivotal in early identification, compassionate counseling, interdisciplinary coordination, and advocacy, helping individuals maintain mental well being and social participation despite visible differences.